Now it's my pleasure to invite the speakers as a common panel here. So please, and while they arrange here, the audience can think about questions relating to the presentations you just heard, because we've been speaking, and now it's your turn to ask questions first related to the presentation. So if anyone has any questions, comments, please ask for a microphone. Everything is clear. Oh, fantastic. Good job. All right. So, well, I have a question, though, related to your great presentation. Thanks on my behalf once more. And that's related to actually Tenna's slide as a university hospital, as innovation hubs. So that was very nice collection of to-dos. But now, Susan and Tenna, how do you see that how is University Hospital Alliance, EUHA, and research institutions and programs, how can they work together and make that scalable? You've done great work in Denmark, but how is that going to be like Nordic-wide or European-wide? What are the magic bullets, tricks?
I think in terms of scaling, there's no magic one. You have to first and foremost overcome the not invented here syndrome, and I think for that it can be important that more hospitals are involved in collaborating also with the startups around the development, because that just having a little more familiarity with the product that is developed will also break down or minimize the barriers to adoption. But I think also, and I know it's not a main task of hospitals and clinicians, but if they could at least just share knowledge with each other about successful implementations of technology, that would, I know it's not their task to promote other companies' solutions, but come on. If you're truly caring about the patient's needs, then you want effective solutions to spread, from a clinician point of view.
Mm-hmm. So how Tenna?
So I would just want that the clinicians, they are sharing across countries about successful implementations of technology. That would help scaling solutions.
So what is your intake to this? How do you see it? Are you, is this the sharing information? Is that the best way to proceed, or?
Yeah, I agree with that. Sharing, I mean, what is actually working in the clinics is good. And also, I mean, maybe we could also use these pan-European networks, both of clinician and hospital management, to also have cross-border need assessments. I mean, that could also promote perhaps some solution or a framework of a solution, because if you then align it with a policy or an area we need to do something about, then you could perhaps more identify pan-European need and then have like a cluster of solution made. And that could perhaps make like an attitude, positive attitude around these, even if, we can take then a solution from Finland, because it's part of, solving some of the huge problems we have. So I think sometimes because it's the same we hear, the aging population, the workforce diminishing and so on. But we sit every country in Europe doing our own solutions. So I think that we should think more strategic together. And then I actually also think that the common data models, that will also be an important, also because we are small countries and so on. And if we have to do, have a chance against other continents, not to make it only a competition, but still we need some togetherness, and I think that will be also really important. And maybe also have to have more like the program Biomedical Design, to have it a bit more scaled in perhaps first the Nordic and on a pan-European scale. So people can also move around, because it is about people. Innovation is about people and relations. So how could we perhaps also create this community a bit more?
Right.
Yeah.
So Heikki, now listened to this discussion. So what is your opinion? But they're talking about sharing, maybe knowledge, but maybe also data, and once that comes to there.
All types of sharing. We actually work in collaboration with the university in Twente and the Radboud UMC, the university hospital in the Netherlands. And they have a study where they scrape from public sources, from Crunchbase and elsewhere on startups in the health tech space. And we've been able to validate approximately 2,400 innovators. When we put them on a map, we see where they distribute. You use cardiology and AI as your tags, and you can see where and what is happening across Europe. I like the idea of putting the clients there on the map as well, so these innovators could tell who they sell to, and it would all be very transparent. And now who we're lacking from this map is the innovators. And the idea here is that the regulatory data could expose them to be the first bit of information about them on that map and see where they are, how soon are they maybe transitioning to CE-marked products and so forth. So this is where regulations again kick in, and we're actually exploiting them for our advantage, the knowledge, the regulatory literacy in pushing innovation rather than considering it a hindrance. I'm not sure if that was your what you were seeking for.
Well,
but
close enough.
This is what we do.
All right, so we move on to the next theme, that's digital health, data, and AI across boundaries. So this is to Johanna and Leena. So now be careful, listen carefully. Now, what are the main barriers to interoperable health data and AI deployment across institutional and international borders? And how can we overcome those? So if Johanna would like to start.
Yeah, sure. I think we've touched upon it through the day about the health data being in silos and not finding it at the moment for the researchers as well as for the innovators. So definitely we need to do that, and the health data space will probably force us. And I think the AI is probably now the leverage, because I think this is something that should have been done, like many, many years ago. But now everybody realized that if we have the data accessible and we can find it, we can also do better research with AI, and that will help healthcare and providers and everybody. I think that's important. We're not there. Everybody's still talking about that it's in silos, and in Sweden we have 21 regions that are in charge of their health data, and they are not having it harmonized and homopified or anything. We are talking about it, still talking. But so that's the state. But I also think for then if we think about implementation, we move a little bit away from that's later, that comes later, and because you need, if you, in AI especially, you train on data, but later on you implement, and then you might need to validate on data. So you might have trained your AIs in one country and you know that it works, but you also need to make sure that it works. Mm-hmm.
Power cut. Do the other mics? This works. This is number 5.
Number 5 works. This is number 6, I guess.
It works now?
And now it works, and now mine works as well.
Okay.
So if you want to move from one market to another, you may also need to validate your AI solution on a new set of data to make sure that it works on that population, on that specific hospital. So hospitals and providers might need to get access for this kind of data as well to retest if they've implemented something. So healthcare data is extremely important.
So Leena, is data in silos in Finland?
Of course, data is in silos also in Finland, but it's kind of comforting to hear that it's in silos in other countries too. But I think there's a bit of lack of trust. We don't trust each other enough to give out our own data. We are trying to keep it within ourselves. And I will expand this a little bit to EU level. You think about the geopolitical situation in Europe at the moment. We should look more to each other, other countries, and do things together, because we obviously have the same problems. Data is in silos. We don't have enough established data models to connect those data sets, and we are not trusting each other enough to build up big data lakes. to do the innovation and validation and production.
Now that Heikki is holding the grip on the regulations, do you want to add anything to that? Or?
Maybe something very quick on the HDS regulations, so that every party would have clear idea on what are the requirements for a health data holder or health data user. The health data access bodies would work fluently in this realm, and the innovators would be confident in providing access to EHR systems, understanding what it really means in their product development process. That's where we can truly help.
Johanna had a comment.
Yeah,
please.
just a comment, because I think it's the EHDS is not clear, even from a university perspective. We are figuring out what kind of data do we need to give access to. It's not clear, and it's hard. We're even part of TEHDAS too, and still it's hard for us to understand. So is it the data that the university has, they have to be, or is it separate researchers have to also give their own research data accessible? So all these levels. And then if you talk about with companies, and we're talking about homologifying healthcare data and maybe research data, but then the companies also need to think about when they collect their own data, should they also adhere to these harmonization standards, which would be the best case scenario. But I think it's a lot of, we need more clarity, as you said.
Right. If there are any comments in the audience, please raise your hand. So, and you want to get a microphone if you want to participate to this. Okay, so further comments on this topic? Maybe, no, not really. So what about the need-based user-driven innovation, and how can we ensure that innovation is truly grounded in clinical and patient needs and not just a technology push? So if Sue starts from that.
So that's very easy. We just need to fund fully, forever, the biodesign programs all around Europe.
Oh, that's great.
Yeah, no, so of course the biodesign programs are really a good structure for ensuring that the innovation is truly grounded on needs. And one fallacy that I see, which is very present in a lot of innovation programs, including also the Danish TEF-Health program, is that if just there's a clinician involved, then we think it's a true need. It's not, because the need has to be not there for both the user, the provider, and the payer, and it has to also be feasible and viable. So it's a lot of things that needs to go together, and it requires actually different disciplines working together. It also requires that we know and understand each other's health systems, because the solutions, they have to be viable, not just in one place, but around. And that access to knowledge about how the health systems work in different places, where are the true sort of patient segments for the solutions. It's some detective work, and we can actually help each other by collaborating to provide and make that information more accessible to all startups, but also to the clinicians that are doing innovation and to the researchers in the universities. You could, if we made a platform with a KOL network consisting of both clinical expertise, but also structural and economic expertise, that could be one way of actually making, or at least attempting to make it more needs-based for everyone.
You brought up something very interesting in your presentation, which was that maybe university curriculum or curricula in particular don't have a special slot for teamwork. So that kind of, because it's so late in the afternoon, I think it's a little exercise. So everybody raise hand who under his or her studies had specific courses in the curriculum which was on teamwork. So please raise your hand. So we test that. Not that many, right? So you were right. You were right. Yeah. So Tenna, getting back to that topic, so how would you complement that, Nora?
I mean, avoiding just, is it on? I'm not, yeah. Whatever. I will perhaps take a bit of a different angle on this, and that's because we're talking about, and I know also in Finland that about this low-value care or a de-implementation of low-value care. And I think that will be super important in the innovations to come and the innovation to be implemented. It has been, of course, also prior, but I think even more it will be not what is possible with AI or whatever, but what is needed. Yeah. So I think that there will be a different way of approaching the assessment of these technology a bit, I hope so. And perhaps also in the HTA, the health technology assessment, I think there will also be a more potent focus on well-being, patients' well-being. So I think that as innovators in this space now, that you should perhaps also try and not refocus, but of course make a clear need, as Sue says, but also take these parameters into precautions. So that how is my product actually doing what is needed, not only what is possible? Because I think with AI, and I've sat in a panel for a lot of years, and I've seen a lot of AI solution, and I must say, not always the best quality. And also, I think a lot of them has been like, oh, but it's possible. Mm-hmm. We can do that. It's possible. Yeah, but is it actually needed? So, yeah.
So would Leena like to comment that?
I totally agree. Not always something that is possible is actually needed. And one thing I really admire what you do in Denmark, teaching the people do the co-work together, because there are so many entities needed to get the best results. And sometimes I think you start to develop something, that there's been a real good work starting the thing, but no one is doing the real follow-up, going through that, is this viable? Is this useful? Is it worth the money? Is this exportable? And we have to learn also, like you said, cut those out that are no good, and not just fall in love with those things we've been done because it works.
Right. So Johanna.
Yeah, I was just wanted to comment on the need is important, but also when there's a need, how does it fit into the clinical processes? Because the need might be, absolutely, but then that might, if especially implementing, well, all innovation, I think they might affect the clinical processes in a way that you don't understand from the beginning of if you want to get patients quicker, but what if you can't get patients quicker? Then the innovation actually doesn't help at all if it's just doing the processes. But then also I think on the to do an innovative procurement process, because that's the way you can actually test and innovate together with the hospital, because otherwise I see huge problems that you do procurement in the normal way and you're not getting what you actually need.
So yes.
Very quickly again, I also would like to see us betting more on the race than on the horse. So not a single innovation gets all the funds, but they are really scrutinized, and we build this bottom up, not only regulatory, but other enablers to make sure that the baseline where we start from is somewhere else than it currently is. And we know that the innovations that we then push forward and fund strongly are good to go. They are viable innovations that somehow tested already, that they are and validated in the hospital environment or elsewhere where they are used, really scrutinized, and it's for everyone's benefit.
Great, we have a question in the audience.
Thank you for the opportunity. My name is Outi Ahonen. I'm from Laurea University of Applied Science. Just want to comment on the masters in e-health in Finland. So there's a joint masters as a managing digital transformation in healthcare. I know there is also in Savonia and the other applied science university, they are masters. So many of these masters, that they are bachelor level, all different kind of bachelor levels. They also can be doctors or entrepreneurs or many different kinds. So all the master is about that they go work together with different kind of background, and so it's interdisciplinary work. And there is also studies like service design, which is quite good teamwork when they do different kind of topics. So like this one, what is now I'm talking about, there's coming over 100 students to the Helsinki in next January, and they go work together. So there are these kind of masters, I think, all over the Europe for now, and it's important that we encourage people to increase their knowledge. Also, at the same time, when you're talking and all this today, I would like to rise up that there are many kind of healthcare professionals. We a lot of talk about now as sort of this medication and sort of if we think about more as preventive care and the multidisciplinary care what we have every time when we have patients around us. It's also rehabilitation. There's many professionals, and I think the innovations are also around those topics. So I think could scale up this discussion, and we will get more innovations.
Fantastic. So, any other questions in the audience? If not, I think we are reaching. Oh, there is one, please. Yes.
Hello. So, Nuutti Matintuva from Siemens Healthineers. Commenting on the need, so we need to provide solutions where there is a clear need. I have been selling stuff for quite a long time, also including AI. Good. And now, when there's a clinical need, that's very clear. But please try to find the person from public healthcare who actually has a need to be more efficient, to save money. People speak about it a lot, but try to find actually the person who makes the decision who really has a need to save money, because it's extremely difficult. So I would really encourage us to find a true motivation for those, especially physicians, who really make the decisions to find this need. If you have ideas on that, I would be very happy to hear.
Anyone here?
Well, I can add that you're completely right, and it is a detective work to figure out who in the different health systems are making the decision of purchasing, and it's not the same everywhere around. For instance, when we are onboarding our fellows, we also ask our clinical partners to do 3 half days of onboarding within the clinic, and one element that we ask them to bring to the table is how they purchase new solutions. And the clinicians in the department participating in that session, they get so surprised. Oh, is that how it's done? So they don't even know themselves, many of them, how they are purchasing solutions. So, you know, innovative purchasing is a framework that has been around for, I don't know, 10 years. And also in Denmark, we have no examples, you know, of using
really comforting, very comforting. Sorry to say.
All right, so I think our time is reaching end, and then there's a final round of concrete proposals. So the question is that in 2 to 3 years, what concrete change or initiative would you like to see implemented to help innovation truly cross boundaries in health? And this is, we go in order, and this is like one sentence type of answer without commas. So please.
Yes, so then I would, what I could dream of would be a Scandinavian biodesign program focusing on developing medical technologies across our key hospitals.
Thanks. Tenna, please.
Oh, there's a lot of things, but I think actually one thing I would take out is actually aligning health innovation issues with policy priorities. And it seems a bit boring, I know, but actually, I mean, I've seen so much bottom-up that hasn't reached target and been implemented, and therefore not making the impact that actually was aimed for. So I think we need something to really do a huge impact, and therefore I think we have to align these a bit more to get more implemented.
Okay, thanks.
We need some success, I think, in the Nordics.
I think we need to talk to each other more, so more this kind of event. So thank you, Otto.
Yeah, and I completely agree. Collaboration and bringing different people together, that will probably, but also having some kind of focus. We need to focus a little bit and be not spread around. And for me, well, maybe for me it's the AI at the moment, but I think AI is maybe just a leverage to do the innovation we've been doing for very many years already.
Great, thanks. Take.
I envision this bright city, naturally, where everything works fluently and everyone communicates. Boundaries are put down, and regulatory is something that is a simple, basic thing to do, and now more the biggest hurdle, like Raki says, but part of also gaining back the data on innovation, how they are doing in the big picture, and just tiny particle within the other important things that we've been talking here in this panel.
Okay, so I'm going to say that we should build trust within each nation and also between nations. That's because that's the final word, because I'm the chair, so I can say the final words. So everybody, thanks for you guys, and thanks for you staying with us here. So the session is